Good morning or good afternoon, depending on where you're joining us from today. As Stephanie said, my name is Elizabeth Zena, and I am a member of the Healthy Communities team at the Minnesota Department of Health. We just want to take a second to get grounded today. Obviously, when we started planning this webinar a couple of months back, we could not have predicted that a global pandemic would be impacting a lot of our work today. So some of you might have had your normal work duties interrupted or even changed completely to respond to the coronavirus. And we just want to acknowledge that in light of current events, the content today about transportation access is still highly important. We're hoping that talking about transportation access today, we can think about those in our communities who are more vulnerable, who are also likely those that are being impacted by the recent measures to prevent the spread of coronavirus and coronavirus in general. So we want to think today about how making those connections in our work can help those most impacted by inequities in our communities. So with that, I will turn it over to the rest of the introductions of our panelists today. Ross?
Hi, my name is Ross Daniels. I am the community planner with the Public Health Center in St. Paul, Minnesota. I have been the planner here for about a year and a half now. It was October of 2018 when I joined. I have a background in rural community development, transportation planning, and in my current role, I still do a lot of transportation planning, mainly active transportation planning, multimodal transportation planning, but food systems planning as well. Today we hope to kind of bridge, connect some dots, if you will, between those two worlds. And I will let Grace introduce herself.
Hi, everybody. I'm Grace Hagelin-Lohman. I'm a research assistant at the Public Health Law Center. I'm also a second-year MPH student at the University of Minnesota studying nutrition. And that's kind of my background. This has been my main project for about a year now. So I'm really excited to talk to you all about rural transit and health.
Brian, would you like to go ahead and introduce yourself?
Sure. My name is Brian McCoy. I'm with Headwaters Regional Development Commission. My primary role here is to improve access for low-income individuals to access work, healthcare, and various others and other institutions. I've been here at Headwaters for about over 1 year or so.
Thank you.
And I think with that, we can turn it over to the next slide. So as I mentioned, I am the community planner with the Public Health Law Center. Many of you have worked with us. For those who have not, we are a nonprofit located in St. Paul, Minnesota, who work on a variety of public health projects ranging from commercial tobacco control to healthy eating and active living. We focus primarily on the really the upstream social determinants of health, rather than really more so than the clinical aspect of things. And I'll dig into that here in a little bit. If you'll go on to the next slide, I can talk about what we do and what we don't. Much of our staff is attorneys. I am a planner. We have a few policy analysts on staff as well. And we do a lot of research into things like ordinances, comprehensive plans, resolutions, memorandum of understanding. We help our partners make sense of this through policy development, strategies to help implement these things. We incorporate a lot of our research into publications, toolkits, webinars like this one, as well as training. Now, a couple of things we do not do is we do not take on clients really to represent, despite the fact that we are a legal nonprofit staffed by attorneys, and we do not lobby. Next slide, please. And the work we're going to talk about today really has its roots in this partnership that has gone on for a decade or so. It predates me by several years. This partnership between ourselves, the Public Health Law Center, and our SHIP partners has been very robust. And through it, we've all begun to really understand the connection between public health and a lot of other disciplines. From 10 years ago when we were working on the Healthy Hunger-Free Kids Act, which strengthened school wellness programs, through a few years ago with the Food Access Planning Guide, which really got communities in the state of Minnesota to think about how to incorporate food systems in their comprehensive plans, which was a very innovative thing. It's something that not a lot of communities across the country really thought about. And through today, when we start to connect the dots between food systems and public transit. If you'll advance to the next slide. So I will run through the outline real briefly. I'll give a background that really brings to bear the connection between public health and planning in general. Talk about where transit and health overlap. And then I will hand it over to Grace, who's going to go from my real 30,000-foot version of things to kind of digging into some of the structures in play in the state of Minnesota to make a lot of these, to really kind of make a lot of these partnerships possible. And then we will turn it over to someone who is thinking about this and working on this in the field. Brian, with the Headwaters Development Commission, has been very kind and gracious to give his time to talk about how this connection between transit and food looks, especially in greater Minnesota. And then we will leave time for questions and discussion. We have until 1 o'clock to do so. And with that, I will begin. Stephanie, you want to advance? So as I said, I'm a planner, and I come from a transportation planning background. Recently, I've been looking at food systems planning. So I really come from this at an angle that really thinks about things like infrastructure. And so this quote is from 2006, way back in 2006, from the Centers for Disease Control and Prevention, which I think really highlighted the future of the partnerships that are being made between public health professionals and planners. And I won't read the whole thing, but they conclude by saying that both fields, both in planning, specifically here transportation planning, and public health have expanded their tools and perspectives, in large part because the two fields are recognizing the importance of one another. And I think that that's a really, prescient quote that kind of foreshadowed a lot of the work that is being done in Minnesota in particular, specifically as it relates to the partnership between the center and SHIP. Going to the next slide. So where do rural transit and public health overlap? So if you can move on to the next slide. I think to start with that question, we need to think of some unique considerations that exist in rural areas as they relate to public transportation and public health in general. Far fewer residents in rural areas utilize public transit than in urban areas, which naturally, not surprisingly, a lot more rural residents have personal vehicles than have them in urban areas. And because of this, a lot of the work that is being done, a lot of the research that is being done looks a lot different between urban areas and rural areas. In urban areas, for example, it makes a lot more economic sense. It makes a lot more logistical sense to fix routes at certain times of day along certain corridors that can transect a mix of uses. You can go from your home to a grocery store. Maybe you'll have to connect once, maybe not. And that allows for a lot of work to be done and a lot of research to be done showing, for example, how residents are able to, how close they're able to get to a grocery store from the final stop on their transit route destination. That's not how things work in rural areas. And as a result of that, a lot of the work being done and a lot of the research being done in greater Minnesota looks at these programs at a very clinical level. It looks at, for example, how the distance between a resident and a clinic or a hospital, how a lack of transit affects the disruption in ongoing treatments for the chronically ill. There is work that looks at how distance cost factors into how much rural residents are able to think about whether or not they can stock up on their prescriptions or afford treatment. Things like that, and it's extremely important work, especially in light of recent events where we think a lot about medication with COVID, and at the same time, if you'll go to the next slide, Stephanie, there is room to really bring in a social determinants of health lens into the work that public transit does. And a quick hat tip to Grace, who will speak in a minute. A lot of the visuals that you see are her own handiwork. And as you can see, the van there has touches a lot of different determinants, whether we know it or not. In the bottom left-hand corner, you can actually see where access to healthy food factors into to health outcomes across a population and in individuals. Things that are not necessarily reflected in a lot of the work that is going on for the time being. So if you move on to the next slide, Greater Minnesota is thinking about this. In fact, the visual I have here comes from the state's transit investment plan, which shows, for example, the benefits of having transit in rural areas, how that benefits job prospects and economic opportunities, how it benefits air quality, getting people into buses and vans, how it helps social cohesiveness, collective efficacy, things like that, that in an age of social distancing, we might want to, shift our focus a little bit. But in general, there is thought that is being given to how we can actually address the conditions that cause poor outcomes, in addition to the poor outcomes themselves through public transit. Rural populations are more likely to suffer from things like type 2 diabetes and heart disease than urban residents are. The Rural Health Institute notes that rural households are more food insecure than their urban counterparts. And although fewer rural residents live in what the USDA defines as food deserts, the definition of a food desert really, it is defined differently between rural areas and urban areas. In urban areas, just broadly speaking, if you're over a mile from, it talks in terms of a mile. If you're a mile from a supermarket, if you're over that, then you're in a food desert. But if it's 20 in a rural area. So if you go on to the next slide, this really brings to bear the public health law centers and our partnership with SHIP's commitment to equity. When you think about what a food desert means to a rural person, sure, a lot more rural people own vehicles, but at the same time, many do not. And when you're thinking about food deserts being defined as 20 miles away, that's not too helpful if you do not have reliable transportation, as opposed to in an urban area, which will probably receive more state level and federal level transportation investment, which when you think about food access, you're thinking in terms of maybe a mile, walking distance, transit distance, biking distance, things like that. And before we turn it over to our poll question, I just want to mention that not long before this webinar, about 45 minutes before, I received an email from Smart Growth America. I'm on their email list, and it was talking about how in the 2008 recession, transit agencies were hit very hard. And, you know, I think we have a lot of those fears today. And I saw an interesting graph, which I didn't even know about, which is that a majority of rural residents, no matter political affiliation, either strongly support or moderately support more investment in public transit. So once we get through this pandemic, we need to think about those types of things when we start to dedicate dollars and dedicate technical assistance to transit agencies. It is obviously vitally important for us to salvage transit in urban areas, but at the same time, let's not leave these rural areas behind, especially considering people in rural areas want it and need it. And so with that, I suppose we will go to, we just want to get a sense of who all is in this room. So get a couple of poll questions up.
All right, y'all, take a couple of seconds and scroll through these poll questions. So first, we'd like to know, what sector do you or the organization that you're joining from represent? And have you worked on any projects that bring together transportation and food systems? We'll take about 20 seconds here to think through these questions. All right, we have a request to repeat the questions. Oh, sorry, it looks like we just closed the poll. So we're gonna see the results here in just a second, if you can see them on your screens. Okay, so here we can see the results of our poll in questions here. We see a lot of representation from our public health partners, couple other organizations, and we've got kind of a few people that have worked on some projects bringing those systems together, but the vast majority of us, this might be a new area. So, all right, we'll see what the rest of the webinar will bring in terms of this content moving forward.
Are there others, by the way, who are having difficulty advancing slides? We see this.
All right, it's looking like most of the people are seeing the slides advancing now. If you have any technical issues, feel free to message the panelists and we'll get that worked out for you. Thanks.
Yeah, so we understand that this is a learning experience for all of us as we're all sort of transitioning to a technological world, at least for the foreseeable future. So yeah, please feel free to chat in or use the Q&A box at any time if you're having trouble. But we're gonna move on to my section, which is what is going on with transit planning and public health in Greater Minnesota. So this project really began with a broad survey of the availability and access of rural transit in Greater Minnesota. There exists a multitude of ways that transit and transit planning affect health in rural communities, and not just in rural communities, in metro areas as well, but we know that there's a distinct difference in the effects and scenarios depending on the area and the geography of which you live. So we began this review with a lens focused on understanding what those unique challenges and what the opportunities are at this intersection of disciplines. So a survey of the transit providers in Minnesota outside of the metro area, a review of each region's local human service transit plan, and of the available statewide studies and investment plans helped us to understand the structure, the function, and the key players involved in rural public transit specific to Minnesota. We also included some national research looking for creative solutions, seeing kind of where this conversation is being taken in other parts of the country. And we actually noticed more than a few gaps. The Transit Planning and Coordination Minnesota, like many other disciplines, is divided into regions, which you can see on the left-hand map. However, transit regions can be and are different from SHIP regions, from county lines. They're different from the boundaries of each transit provider, and various other things, as well as state lines. Especially in Minnesota, we know that we have connections with the states close to us, and that some of our metro areas kind of sit on the boundary with another state. So in part, our analysis of the rural transit just helped to build a foundation of the understanding of some of these complexities. So Minnesota Department of Transit provides financial assistance to the transit systems operating throughout Minnesota, and specifically to the 80 counties outside of the metro area. And we know that those 80 counties don't just encompass what we consider rural communities. They also encompass 7 urbanized systems that receive their funding directly from the Federal Transit Authority. But most of those rural communities are receiving their transit funding through the state. And a variety of these funding mechanisms can make it not only confusing to understand, kind of confusing to how these transit development planning. And so one of the ways that really shows that and elaborates that is if you're looking at the map, and you can see the regions on the left-hand side, those are the transit regions. Some of those are really large regions, and some of them, we know that they are distinctly different from SHIP regions, but also if you look at it in comparison to the map on the right. So the map on the right is the Transit Dependency Index, which is produced by MnDOT, which kind of shows a variety outside of the metro area, that even just in Region 1, for instance, there is a huge variety of need and dependence on transit, whether that's lack of vehicle access, distance to and from employment, grocery stores, childcare, recreation, whatever that may be. We know that all of those social determinants of health are coming into play, and there's not a one-size-fit-all solution for the state as a whole, nor is there for each individual region. And so we know that the distance is one of those aspects, and it's a limiting factor, but so are things like weather, the roads and pedestrian safety in communities. And then we also want to be thinking about, in current times, what this means for minimizing transmission, what this means for people who are quarantined, what this means for isolation, and how social distancing comes into play in rural communities as well. Next slide. So some of you will probably think that a lot of these things look familiar no matter what field you're coming in. I know the polling questions, the majority of the room is in public health. And these are some of the same challenges that are facing public health, that are also facing transit planners in the state of Minnesota. So things like population growth. We know that the population is growing. We know that some of the population is moving to more urban centers. In general, we have an aging population. Everyone is concerned about access to employment, although that may become different if more of these things move online, at least for the foreseeable future. But it's still really important to understand who needs to get to their job, who needs to be accessing transportation during this time and moving forward. Specifically childcare, whether we use those school routes or not, what that looks like. And there's some creative solutions. You know, some of St. Paul is using their bus routes to bring food to people, or food, weekly meals to students. But if you don't necessarily have those fixed route services in your rural community, or the infrastructure to do so, we need to find more creative solutions. And then I think no matter what sector you're in, funding is always going to be something that we're facing. So anytime that we can use collaboration to get really creative with our funding resources that is to everyone's benefit. And I think a lot of the community planning that we can do is one of the major opportunities in order to assess how we can minimize the burden on each individual. So next slide. So we know that this is kind of a square peg in a round hole. So just like you saw all of those different regions in the map, they're not squares, they're not even circles, so it gets a little bit more complicated. So next slide. So how do we bridge the gap between the communities that we're working for and working with? How do we connect them to those public health resources, and what tools do we have at our disposal, either to bring the community members to those resources or to bring the resources to those community members? Next slide. So there's a lot of different creative solutions that we can use to bridge that gap. Transit planning and transit-oriented development just being one of those. I encourage you all to think of the ways that you can bridge this gap in your communities throughout the presentation that we can discuss kind of at the end, or that you might already know are existing in your community or in a neighboring community. The more that we can share these creative ideas, the better. And it also involves translating. Both public transit and public health use a lot of acronyms, use a lot of jargon. So developing a shared language so that we can translate from one to the other is also going to be really important. And one of the ways that is kind of using all of these collaborative strategies to come up with the creative solutions to these problems are what Brian's going to talk about. So RTCCs, or the regional transit coordinating committees and councils throughout the state, are kind of bringing together all of the stakeholders from a lot of different disciplines who really have a similar interest and who can help us make these connections. And so with that, I'm going to turn it over to Brian McCoy with the Headwaters Regional Development Commission. So in northern Minnesota here, and Brian's going to talk about some more specifics for what's happening in his region. Thanks, Brian.
Sure, Grace, thank you. So this is kind of nice that we've been working on this as access to food with ourselves as a region, and then it's kind of interesting how this is all starting to like join with other state groups. So it's going to be exciting to see what happens. If we can maybe start with the going, Grace, or please next slide. Perfect. So for those who aren't familiar with Headwaters, this is kind of our history or our background. We're based in the upper area of, we're based in Bemidji, Minnesota. We serve 22 cities, White Earth Reservation, the Red Lake Reservation, and portions of Leech Lake as well. Our population is roughly is about 85 other people. 18% of those are over age 65, and close to 18% of those are at or below the poverty level. Actually, we have some of our counties are kind of the lowest of the highest rates of as well as poverty as well. Kind of things that we do is all over the board. We do economic development, housing development, and of course transportation planning. We're the host site for the Regional Transportation Coordination Council. Please, next slide. So for those who aren't familiar with RTC, it's kind of this state MnDOT program that's just now starting to kind of happen. I think it kind of began in the year 2018. Basically, MnDOT was kind of tired of there's all these vans and all these entities out there that have that that provide transportation service, but there's still certain areas where, you know, there's entities that still exist of gaps of low-income people getting to jobs, healthcare, food, and various uh, 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 various other entities. So what the state of Minnesota has done, they've created these RTCs that are kind of across the whole state. Each RTC is kind of unique in how it's done. They kind of have their own, you know, so it's kind of an interesting process of, you know, each area has its own thing. If you go on to the next slide, perfect. So this is kind of either our RTC. We have a nice wide group of people. We have those who we have nonprofits, we have social services, we have officials, we have those who are elected, we have some people who operate transit, we have some that are on youth services. So I'm pretty proud of how broad our RTC group is. We currently meet every other month, or more. It kind of depends on the need and the issues. As you can see, our goals are kind of broad. You know, how can we get more people who don't have transportation to their end destination? If you go on to the next slide, please. So these are kind of the issues that we as an RTC group in our region have found out as big issues. Of course, across the whole state is getting to healthcare. There's just not enough options out there. There's not enough people to help get those rights. We do have some workforce that work off shifts, and there's no transportation options for those individuals. Kind of a unique challenge we find in some of our counties is getting to court. For example, they will be arrested and they have to hit a trial for something small, and then they end up missing their trial date because they don't have a ride. And that kind of opens up a whole new issue. So that's kind of a unique problem that we have. There's not a lot of Lyft type of options in our region. If you need a ride, everything has to be prearranged. There's no last minute options. It's really hard to travel from one area to another. Say if you need to go to Baudette to Rochester and you don't have a car, the options are very hard. There's just not a lot out there. And then finally, you know, kind of related to this is access to fresh food. Go to the next slide, please. So this is kind of a map I created, put off the USDA website. As you can see, there's a large swath of our county population that is low access tracks to grocery stores. The areas that are in the light brown are kind of the low access tracks. Interesting enough, we have a large percentage of households do not own a car. That also does not include how many households that only have a car, but maybe that car has to be used among, you know, a mom and a dad, and, you know, dad has to use it to work, and the mom doesn't have one to, you know, run, you know, to groceries. So as you can see, there's a large segment of the population that doesn't have their own options. Go to the next slide. So these are kind of the identified problems of what we think or why, you know, people are having a hard time getting access to food. There's some areas of the region doesn't have transit service that's offered often. So, some only offered every Wednesday. So if you have to go to the grocery store, you got to make sure it's only on Wednesdays. As you know, if you're low income or some other populations, it's really hard to plan for that type of thing. Some providers who do offer transportation, you can only bring in one grocery bag of food, which if you're a large, family is just not enough for a week. Once again, all transit rides need to be prearranged. So if you happen to be out of eggs or milk and you have to go get it without your own transportation, you're kind of stuck. Once again, there's not enough options that don't involve transit. There are some programs that do give rides, but they're very specific on who can use that service. Some of the senior food sites also do not have access to public transit. So that's kind of also a huge issue as well. And then no stores kind of have their own delivery service at this time. So the next slide, please. So this has kind of happened before this whole outbreak sort of start. So basically this stuff is kind of on hold until you figure out exactly what's going to come next. So one community we're looking at is the city of Blackduck. It's about 25 miles from here and here. It's a very, the population there is kind of leans towards elderly side, kind of leans towards the lower income side. There's also a broad swath of the population that don't live within this the city also. There is one place in town that does have groceries. However, there's only transit operates there only once a week, and I believe it's only every Wednesday. So once again, you have to plan kind of ahead of time when you're going to go get groceries. And also that transit doesn't really go all over the area. I mean, there's a route and it doesn't really go off of that route much. So if your household is not near the stop location, it's going to be hard to access as well. And then some other project that just got started last week as I met with people is the Bemidji food shelf here is looking to expand within the region. Currently, the only place they offer is here in town, and they're really looking to figure out how to get more access to that, whether to have more options to bring people into the food shelf or figure out a way to bring the food shelf goods out to the population. We said we met last week and we just kind of got some ideas. However, the whole virus thing has kind of put everything on hold at the moment. So if we go to the next slide. So once again, this is kind of what we had planned. So basically, I'm trying to figure out, okay, meet with various owners around the region who have grocery stores. What are they open to doing? Are they looking to do some type of online service? Do they have staff that could, do, if you call ahead, do they have staff that can go get that, order for them? Kind of going to outreach to the public as well. Say, hey, if we offer some type of service to make it easier to get food, what would you be interested in? Would you be willing to help out? Do you know people that have, this issue? they're trying to also identify, okay, who else can help out with this? Are there other nonprofits that are interested in this problem? And are there options also there to, to look at? And then, what are the options that we're trying to explore? Maybe one idea that's we kicked around is use students that are in high school. They get out every day afternoon. Maybe they could go and we could work with the local high students and say, hey, we have people that need, they could kind of get the delivery service. Is there a way people can get the orders, call in the orders? Are there partnerships to maybe we can increase rides? Can we add an extra route, bus route, or can we do some type of other program to just offer more options? And finally, maybe we should look at how access to the grocery store is access, if you're able to, if you live within, 4 or 5 area of the grocery store, is it able, ADA stuff, are able, are they able to get there safely? So those are kind of the ideas that we have at the moment. I'm also, open to any other ideas that anybody has. And the next slide, please. I think that's the last one. So yeah, that's kind of my information. If you know any other ideas of how people are getting access to fresh food, or any grants or programs or projects that are occurring, I would like to hear them. And then if you want to be updated of what I'm doing, please also kind of reach out to me as well. That's all I have. Thank you.
All right. Thank you so much, Brian, Grace, and Ross, for providing all of that wonderful content for us today. If anyone has any questions, feel free to put them in the Q&A box, and we'll go ahead and pass those along to our presenters. So we do have our first question that came in. And Brian, I know you talked to this a little bit, but Grace and Ross, I want to see if you have anything to add. So the question is, do we know of any rural transit operations or other options in rural areas that are involved in delivering groceries to areas without access to a grocery store, rather than bringing the individuals to the food? This person then clarifies, with the current COVID-19 situation, it sounds like food delivery may be an important way to limit exposure while making sure that folks have access to food.
I am not aware of it. This is all so new. I've got to say that I'm not aware of any transit provider doing that type of thing just yet. I'm looking at, for example, this is not the same thing, but places like Uber Eats and maybe a couple of other private companies that deliver not groceries, but food, are starting to waive their delivery fees to doing that. I don't know if Instacart or anything like that has been doing that yet. And I don't know how that would translate to a public sector, public service like a transit system. But really kind of breaking down some of these additional fees that are required in order to account for the overhead of getting groceries delivered. These are things that transit planners, I agree, are going to have to start exploring in the near future. Maybe there will be some partnerships with Instacart or Amazon Fresh or something like that, or maybe it will come entirely from the public sector. But you're right, it's becoming very advisable to limit interactions for the time being that come with going to the grocery store. And I don't know if anybody else out there has any thoughts.
Sure. So I know in my region, there's a couple of nonprofits that do provide grocery delivery service. If you're over the age of like 65, However, for those low income individuals who are not at that age range, there's really no grocery delivery options in the rural area. I do know that public and transit here in Bemidji is now delivering food in Bemidji on behalf of the food pantry. So I'm interested to see how that goes. And I mean, I hate to use the word, don't waste, hopefully this coronavirus, as bad as it is, will also show there is a gap in access to food. And once this all kind of dies out in a month or 6 months, however long it is, we can, kind of get back up and figure out, okay, this was a problem. What can we do to make sure this does not happen again?
And I want to say there is some response coming in from our audience about things that they hear in their communities. So I see that Instacart is delivering groceries in the Fergus Falls area. Some restaurants are offering to deliver meals and other food and non-food items as well. And I saw another comment in here.
Yeah,
that was another question.
There's
Go ahead, Grace.
So Beverly typed in the Q&A box, and I wanted to acknowledge this as well, that there are, so Beverly said that there's a clinic sponsored CSA box distribution program, and there are some other, that's something that I did come across in the research is CSA distribution to more sites, and that is definitely piloted and done the most, ironically, in urban areas, that there are different distribution sites throughout the Twin Cities, but that is something that is a good model, especially come growing season, come summer and fall, turning to community shared agriculture, community supported agriculture, not just for patients, although there is there's a lot of expansion of the quote unquote pharmacy RX programs, prescribing healthy foods, fruits and vegetables to patients, but that can be expanded to the larger community as well. A lot of some of the solutions are of those mobile food sites, mobile food pantries, providing access, grocery stores, mobile pantries that come to senior or assisted living homes, and school sites especially. But I think Brian brought up a great point that this is going to expose a lot of the cracks in the system, so we can be looking for solutions throughout this virus crisis.
Thanks, Grace. We have another really great comment from Kristen in the chat box, expressing a desire to bring back the milkman concept. So some daily or weekly deliveries of fresh fruits and vegetables, maybe dairy and paper supplies as well. So I think that that's a really great point, bringing back a system that we used to have in a lot of these areas that could potentially be brought back. So that is a great thought, and thanks for sharing that, Kristen. If any other participants have thoughts or ideas, please continue to share them in the chat box. But I'm going to go ahead and bring up the next question for our panelists. We have a request to maybe share some more about the connection between affordability of food and distance. This person writes that they know that transportation costs for those in rural areas to drive 30+ minutes to get to their food. Any thoughts about how that impacts people affording food?
So I came across a lot, and this kind of gets back to one of the points I made earlier about how a lot of the research that is being done and a lot of the programs that are being developed related to public transit and public health in rural communities really relate to clinics. And it's extremely important work that's being done. But I saw that and I don't have the numbers off the top of my head, and I can forward you the link. I think it's from the Rural Health Institute and their transit hub, and it shows a positive association between a number of things. One being distance from distance of an individual to a hospital in a rural area, and cost. And those costs are kind of they percolate into things like whether or not they can afford their treatment, which is especially bad for chronically ill people. And we see a lot of the transit service plans that we looked at in Greater Minnesota talked about things like there was one that was talking about a partnership between the region and the Mayo Clinic. A number of them had representatives from the healthcare sector on their board, but when doing some of this research, I did not really encounter much work that was being done related to things like distance and food or distance and physical activity. It was very much distance and medicine. Again, extremely necessary and useful work, but that tends to be where the research and the programs are being done. And it's worth exploring more, that relationship between distance and food costs. I just don't have any, and I'm sure it's a positive correlation too. I just don't have any numbers to attach to it based on the research that I've seen.
So a couple of things. The next slide is also going to have quite a few resources that we found useful. Sorry, my dog is very loud. But those all have hyperlinks to different resources. A lot came from the Rural Health Institute, which is a really amazing resource on both of these topics. And then I also think, piggybacking off of what Ross said, that maybe we don't exactly have a lot of numbers on what the financial cost specifically between food and rural transportation is, but we definitely know that time, it costs a lot more time. So even if you have the same number of work hours in a day, if you have to drive 30 minutes plus to the grocery store back and forth, that is a huge burden, and not everybody does have that. And oftentimes people are resorting to the closest option, which sometimes isn't a grocery store. Most frequently in rural areas, it's a convenience store, it's a corner store. So there are healthy corner store initiatives. There are things that we can do. And then additionally, I think the next slide as well also has links to your region's RTCCs. So I think any way that we can partner and bring some of these ideas, in addition to finding out what's already going on in those communities, it is going to be really helpful, because it is constantly evolving, and we don't have a perfect solution for it right now.
Thank you, Grace. Another concept that is continuing to pop up in our chat here are mobile food shelves, and that's a model that's received a lot of support over the past few years. There is some funding from the legislature to support this, and Hunger Solutions has been really involved in expanding mobile food shelf efforts. So that's a potential connection with transit agencies as well, if there's a way to maybe link mobile food shelves with rural transit providers. We've got a couple other suggestions that have come through the chat as well. Mike mentioned that Schwann's is using their trucks and infrastructure to deliver food to people living in rural areas that are affected by coronavirus, and that could be a potential partnership that continues into the future, as a couple panelists have mentioned, as we highlight the gap in access. And a couple other thoughts that have come through, that there has been some funding from the Good Food Access Fund to fund a mobile market on the White Earth Reservation. So again, that is a topic that, and a concept that's receiving a lot of support in the state. Another suggestion that came through, a potential partnership with mail couriers to deliver food and non-food items from local stores. So those are more thoughts that are coming in. We had another question that came through the chat. if there was any opposition that came about when working on this project. I believe this question is directed to Brian, especially working in southwestern Minnesota. Any worries from car dealerships having issues with this work, since a lot of people in communities purchase their cars? So Brian, I don't know if you have any thoughts to add about that.
It's an interesting question. So far, no. I think because we're trying to test pilot some ideas in this one town first. There's no auto. It's a the reason that we chose this town of Blackduck is the community itself. They're one of those communities where if there's an issue, they will kind of help out together and you know, they'll kind of all, you know, kind of help out together. I said, hopefully, once I finally get opportunity to go out and ask people in the community about this project, like, I don't know if a lot of people know what's happening yet. But so far I've not heard anything bad about the idea, but I'm sure there's always the opportunity chance.
Great, thank you, Brian. We are now entering the final 3 minutes of our webinar. So if there are any additional questions out there, or if our panelists would like to add any final thoughts to kind of wrap us up, if any of the questions or comments brought any new ideas or thoughts to the front of your minds that you'd like to share.
Yeah, just looking at the chat box, I'm seeing, like, you know, a month ago, who would have known that this is kind of where our conversation was going to lead. I was envisioning maybe, you know, thinking about possible, you know, data collection strategies for this type of work, which is obviously super important. But the fact that this pandemic has come along is really, you know, it's not a good time. You know, it's a very, everyone, I'm sure everybody is very, you know, anxious to some extent. But the ideas that might kind of emerge from this, that, as Grace alluded to, might help to kind of you know, bridge some of these cracks that were always there but maybe weren't so visible until now, might come out of this whole thing when it's all said and done. And that's kind of just that's kind of what I've gotten out of seeing a lot of just the really thought-provoking things that and discussion that is going on in the chat right now. So that's kind of my final thoughts.
For this last slide, if you don't know your RTC contact, reach out to me and I can get you the information. We're kind of in tune to who's in charge of what region. For those who live in the Twin Cities area, there's RTCs there as well. There's kind of called some other name, and they're not quite as big. But yeah, if you have any questions of who's kind of leading the RTC in your region, I am here to help.
Grace, did you want to say any final words from your perspective?
Yeah, just I think that despite there being a lot of cracks and that seem like negative, I think the more important thing to take away from all of this is the opportunity and the position of power that you guys all have to be able to help find solutions. And I think this project has been really elucidating for a lot of reasons, and I am mostly just inspired by the kinds of creative solutions people have come up with, not only in Minnesota, but throughout the country. So I have no doubts that the same kind of creativity will come into play here.
Great. Wonderful final thoughts from everyone. I'd like to take this chance to thank all of our panelists again for sharing all of your wonderful content and experience with us today. Thank you to the participants for your rich discussion in the chat. I think you brought out a lot of wonderful points for us to discuss, and hopefully we can keep these conversations going. Thank you to Stephanie for facilitating all of our virtual participation here. As Grace mentioned earlier, this will continue to become perhaps the norm for a lot of us in the next coming weeks. And so it's really helpful to have great people around to support that tech. So with that, we are going to wrap up this webinar for today, but let's note that that is not the end of our discussion on this topic. Please continue to talk with each other. We'll follow up with y'all with posting the webinar recording and making sure you have access to that. And a reminder to please complete our evaluation that's going to pop up so that we can continue to improve the webinars in the future. So thank you everyone for joining us today, and we'll talk to y'all soon.
Thank you all.